I'm James Adams. I'm the director of ASU's Autism Asperger's Research Program. I'm also the president of the Autism Society of Greater Phoenix. I'm the president of Autism Nutrition Research Center, and I'm also a parent of a young adult with autism. Autism is a major developmental disorder. It includes three major problems. One of them is a major problem with speech and communication. Another is a major problem with social interaction, social understanding. And the third is a problem with behaviors, especially repetitive, stereotyped behaviors. Autism is a spectrum disorder, so you can have very mild symptoms, you can have very severe symptoms. And also there are often a lot of co-occurring medical conditions with it. So some people with autism may have intellectual disability, and some yet may be very bright. Many will have sensory sensitivities, hypo or hypersensitive to many different senses. Some will have poor muscle tone or poor coordination. Many of them will have GI problems. About 25% will eventually develop seizures, sometimes in childhood, sometimes in adulthood. So there are many different co-occurring conditions that occur along with the core symptoms of autism. But the biggest part of autism is the lack of social awareness, social understanding. Autism literally means living in one's own world. So autism being a spectrum disorder and yet often involving language problems. Some people, like my daughter, are completely nonverbal up until age 5. And then she slowly gained language, but again, just single words at a time, very slow to learn. Some people with autism may seem to have normal language, normal ability to speak, but after they've talked at you for about 20 minutes about their favorite interest, you realize they don't really understand conversation, the back and forth of a conversation. They know how to talk at someone, but may not be so good at reciprocal conversation and really understanding the other person's point of view. Autism is due to both genetic and environmental factors. Still a lot of research is being done in this area. We know that about 5 to 20% of cases of autism, people have a major single gene disorder like Fragile X, and about half or less of people with those single gene disorders will develop autism, but half or more of them won't develop autism. In addition, there are many environmental factors that seem to increase the risk of autism. One of the most important ones seems to be folic acid, that if a woman takes folic acid at conception, then she has a 40% lower chance of having a child with autism. So a lack of folic acid seems to be one of the causes of autism. Unfortunately, if a woman takes a prenatal supplement at about 2 months, it has no benefit. It has to be taken at conception. So we know it's very early in the development of the fetus that parts of autism are developing. We know another major risk factor is low iron, that during the 3rd trimester, about 40% of women develop low iron because their body is making a lot of red blood cells. And if they develop low iron, they have about a 5 times greater risk of having a child with autism. We know that part of the reason that folic acid is very important is that it helps make glutathione. Several studies show mothers of children with autism and their children have low glutathione, and that's the substance that's one of your major defenses against toxic metals and toxic chemicals. So there are quite a few studies showing that kids with autism, if their mothers are exposed to toxic metals or toxic chemicals, they're at higher risk of developing autism. And children with autism, often, many studies, but not all, have shown they have higher levels of a range of toxic metals. So there are many different factors. Increasing parental age can be a minor factor as well. So we still have a lot to learn about all the many causes of autism. And there's probably not one cause. There are probably many different causes. But our genes don't change very rapidly, whereas environment has changed dramatically in the last 100 years. So most of the increase in the rate of autism seems to be due to a change in environmental factors. Lack of key nutrients like folic acid, increased exposure to toxic metals, toxic chemicals. So the rate of autism used to be very rare. When I was growing up, I'd never heard of anyone with autism. Rates were of order 1 in 10,000. And over the last 20 to 30 years, rates have greatly increased to 1 in 1,000, 1 in 100. Latest numbers show about 1 in 68 as of a few years ago, perhaps even as much as 1 in 45. So the reason for the increase in rates is partly due to better diagnosis. Some people who might have been diagnosed with intellectual disability now would get a more accurate diagnosis of autism. But most of the increase seems to be real, that in fact there are just much greater numbers of people with autism today than there used to be. And so in terms of the rate in boys versus girls, autism occurs about 4 times as commonly in boys as in girls. So my daughter seemed to develop autism from birth. Some children with autism seem to have autistic-like symptoms or be very slow developing from birth. Some seem to develop normally up until about age 2 or so, and then have a sudden major regression and lose a lot of their skills and language. And so with my daughter's case, she was very slow learning language. She didn't have any spoken words, and she didn't even understand her name when we call her name. And so at age 2, we had her hearing tested. Her hearing was fine. We knew that because she would watch videos. She could respond to noises. If we opened up the refrigerator, she'd come running. But she was diagnosed with autism at age 2.5, and also diagnosed with a very low IQ, but that was because we were using an IQ test, which was a language-based IQ test. And so it's like asking someone who's deaf to do something. If they don't understand language, you can't assess their IQ. So it's important to do IQ tests with nonverbal IQ tests. And then slowly my daughter again began to gain some basic skills. We started one-on-one behavioral therapy at an early age, 20 to 30 hours a week, shifting up to 40 hours a week. And by age 5, still nonverbal, but began to understand some things that we did with her. And we could slowly learn to teach her to speak. So she'd take me to the fridge if she wanted food, but she couldn't even point because she didn't understand the concept of pointing. So I would say drink, and she'd say "cuh," and I'd give her a drink. And then we'd say, "Want drink, I want drink, I want drink, please." Several years of intense therapy slowly built up functional language. There are a lot of things we could have done better with her therapy, focusing more on functional skills. I think would have been something that would have been very helpful to her, making sure the language we were teaching were words that would help fulfill her needs. So if it was for a favorite toy or for food, and focusing on those skills. So my daughter's now age 23. In addition to autism, she has an intellectual disability. And so when she finished high school, she was functioning at about the 2nd to 3rd grade level. We were thrilled to see that she did learn to read and write at about the same level at which she can talk. She can talk in short phrases. Grammar's a bit mixed up. Still doesn't quite understand tenses. But we've worked on a lot of very functional skills for her. So now she can complete many of her self-care skills. She can get dressed in the morning. She can fix her own breakfast. She can pack a lunch. She heads off to work. She works at a special internship program, long-term healthcare facility. She had been doing some housekeeping work. Now she's doing laundry work. She just got a raise we're thrilled about because she's working about 75% of the level of a typical person. And with a lot of support, now in the evening, she can cook a meal. She can do grocery shopping with a little bit of help. She can take a bath at night. She's really very, very functional. And probably within a few months from now, she'll be moving into an apartment with a roommate who will assist her with some things like grocery shopping, transportation. But there's a huge amount that she's been able to do, even though academically, intellectually, she's very limited, and also socially. She's never really understood the concept of a friend. She's never in her life asked to have someone come over and spend time with her. She's friendly with people. She's very caring towards her family. She likes to be around people, but still this whole idea of a friend, just unknown to her. And at age 23, she has no concept of romantic relationships, which makes life perhaps a little easier for us, but it means she's missing out on a big part of life as well. So overall, I think one of the messages I'd give to young families is that my daughter was on the more extreme end when she was younger. We did a huge amount of behavioral medical, dietary interventions. Each one of those seemed to help a little bit, and slowly, gradually, over time, she made progress. At age 12, she'd finally developed to the point where she could say, "I love you," and mean it. And that was just incredibly moving. So I think that as parents, you have to accept that our children are developmentally delayed. They're going to make progress, but the progress will be slow and just means we can treasure every moment, every step that they have with them. I think it's important to have a lot of hope that about 10 to 20% of children diagnosed with autism will eventually lose that diagnosis. And with intensive intervention, with appropriate medical and nutritional support, I think we can push those numbers even higher. And even if we can't remove the diagnosis of autism, we can help people become a lot more functional. Today, most importantly, my daughter has a happy life. She's doing meaningful work. She's with a family who cares about her. She has a respite provider. She's effectively her best friend, even though she doesn't really understand that concept. And so we're very happy to see how much she's been able to do. And overall, there are a lot of people who are higher functioning than her, but aren't very happy with their lives. And she's generally very happy, and we're very proud of everything that she's done. So for parents, I think the best advice I can give is to love your child, accept them very much as they are, and yet try to help them as much as possible to improve in many different ways. The Autism Society is one great source of information and parental support. It can help a lot to talk with other parents. Also, the parent mentors can give advice on how to obtain services. One of the most important things to do is to apply for services through DDD, the Division of Developmental Disabilities, and they have a range of services that can be very helpful. I think also learning to interact with your child as much as possible, because parents are really the best hope of developing a social interaction and a social relationship with the child, and they're going to be there for a long time. Therapists will come and go, but the parents, and if there are siblings there, will have the best chance of interacting and supporting with them. It's also important for parents to know if they do have another child, there's about a 17% chance that that other child will develop autism, so they should really watch any other children carefully and check for them, because even if they don't have autism, they may have speech delays or other problems. So all siblings of someone with autism should be evaluated as well. And so I think those are some of the main things for parents as the children gets older, looking for special ed services from the school. In terms of some of the most useful therapies, behavioral therapy has the most research behind it. Intense behavioral therapy, 20 to 40 hours a week, preferably by trained providers who are supervised by a board-certified behavior analyst or a similar expert, is very, very helpful. In addition, nutritional interventions seem to be helpful. Dietary interventions can be helpful, and some medical interventions. There's no medicine that will reduce, that is FDA approved for treating autism. There are a couple that can reduce certain symptoms of irritability, but they have side effects as well. So my personal opinion is to hold off on medications, especially when the child is young, and try nutritional and dietary interventions first. But medications can be used as a last result, and for some adults, that can be very important. So for providers, I think one of the most important things to do is to interact with the child and get a good sense from the family of what sort of thing the child's like, and focusing on teaching functional skills. So colors may not be very functional, whereas teaching words so the child can find their favorite foods or their favorite toy, or knowing that they want to go outside to swing in a swing. Finding out what their key words are and teaching them either the words for that or sign language for that, or to use a picture exchange system. And then using the natural environment as much as possible so the skills that they learn can generalize. Probably the most important thing is that the sessions with the child should be fun, that when the therapist shows up the door, you want the child to run to them, not run away screaming the other direction. So keeping the sessions fun, keeping them motivating through a wide range of motivational activities is really important to try to build that interaction. Also, if there's a speech therapist or occupational therapist, they're only going to see them an hour or so a week typically. But if you can get advice from them on what skills they're trying to teach and then implement them through many hours of habilitation or respite, that can be a great way to multiply the effect of that speech therapy and occupational therapy. And so to increase the effectiveness of those interventions. And so those are really the most important ways to help a young child to interact, to focus on the skills that will be functional for them in the long term. If you can improve their language, you're probably going to decrease a lot of the behavioral problems that they have, because behavior, if a child's screaming or throwing things, that is their communication. That is often their only type of communication, to say, no, I don't want to do something. So if you can improve the communication skills, a lot of those behavioral problems will just disappear.